Welcome to Growth Happens in the Dirt. I'm Katie Jolly, a Dr. Amen elite brain health trainer and naturopath, and this is my story of brain injury and a pathway to heal, which will hopefully help you and your loved ones. I wrote the book for survivors and their families, and then realised I couldn't actually read or tolerate screens for several months after my concussion. So if this is where you are, this is for you. Each week, I will read a few pages of the book, now available on Amazon as paperback and Kindle, which, along with my story, contains clinically proven tools and methods to heal. Growth Happens in the Dirt, Chapter 3, Part 2. The Tools. Compound concussions. It is important when you see the specialist to mention any previous concussions or whether you have played a contact sport in the past that may affect your healing. Many accumulated knocks over the course of time can affect your brain health. If you're a parent of children who play contact sports, be aware that head injuries are accumulative. If you notice any changes in personality or your child complains of headaches, nausea, or behavioural issues at school, you will benefit from seeing a concussion specialist to assess their brain health. Get an advocate early on. When you have any appointments during the first stages of concussion, and even in later stages, if you have had a traumatic brain injury, always take someone with you. That person needs to be your driver and can voice any concerns that you may not be noticing at the time. If you're unable to fill in forms, this person can do these for you. There is a real risk if you don't have an advocate. Due to stress, you will miss vital information that may help you in the long term. Depending on the level of your brain injury, you may or not already have an advocate. So why do you need one? You may be under stress, visiting doctors and specialists, and the environment will cause your brain to malfunction. You may not be able to articulate your needs well. You may not remember what has been said. You may not be heard and therefore not get the care you need. Your memory may be impaired and miscommunicating vital information that the specialists need to tailor your care. What to do before any specialist appointment. Be prepared before you see the doctor, physio, or any specialist. Prior to the appointment, get your support person to take notes of all your current symptoms. Is your medication working? Not working? Are there side effects? Are there any new symptoms developing? How is your sleep and mood? Has there been any change in your pain, increase or decrease? And an increase in head pressure. All of your symptoms are relevant, and if there are any changes, your doctor or specialist needs to know. Often, a specialist's office will have fluorescent lights and noise, which can trigger symptoms. This may affect your brain function during the appointment. You may want to wear a peaked cap, silicone earplugs, and in the waiting room, wear sunglasses if needed. Write down a list of questions before the appointment, as often with the medical system, there will be no access outside of this time. Take your questions with you to get answered during the session. Ask your advocate to take notes, and if you can't articulate how you are feeling, allow your advocate to speak for you. You may have to grant permission for your advocate to act on your behalf if you are dealing with government organisations. If you are entitled to any benefits or additional support, having a person helping to navigate the government organisations will be helpful. Always review your medication if it is not working for you, or if any symptoms are not improving and worsening. This is really important because there are multiple types of medications, and it may just be that the one you are on is not suited to your body. So always communicate with your doctor on side effects and symptoms. Testing for concussion. Please be aware that your local doctor may not be trained in concussion. Having a brief balance test is not enough. If you are still symptomatic, it is vital that you receive an assessment from a specialist who is trained in head injuries. Concussion screening tools check the brain's processing and thinking function after a head injury. They measure physical skills such as balance, but also mental skills such as memory, concentration, attention, and how quickly you can think and solve problems. Depending on where you get assessed, they may also look at how your eyes are moving, your ear salts, which can become unbalanced, causing vertigo, your neck function, because most head injuries also involve whiplash. If you can reverse information, like saying the months backwards or subtracting numbers, your history of concussion, and any other issues such as ADHD, ADD, or mental health issues. The severity of concussion symptoms, headache, nausea, sensory issues, etc., and whether there are any urgent issues like developing seizures, numbness, or weakness in the body. If you're at home and your loved one has suffered a head injury, there are some basic tests that you can perform to confirm whether concussion may be an issue. Do they feel dizzy, nauseous, or have a headache? Ask them to track your finger with both of their eyes. Draw a large X with your finger and see if they can follow with both eyes. If there is an inability to track the finger, or tracking the finger makes them feel nauseous or sick, it is likely there is concussion involvement. Is there any slurring of speech? Is one pupil larger than the other? Is your person sensitive to light, sound, or movement at all? And they may suddenly develop travel sickness in the car. Has there been a sudden change in behaviour, more aggression, anxiety, or confusion? Then you may like to ask them to repeat a basic sequence backwards, like 10 to 0, or remember a birthday or another important date that they would normally know. All of these things can give you an indication of whether you need to move forward with looking at a specialist appointment. Medical diagnostics. There are several diagnostic tools that you will go through to diagnose your brain injury. From simple balance exercises and memory to psychological testing, you need to understand what the bigger ones do so that you can push for further assessment if you are not getting better. Understanding what the tests are can help. An X-ray will see broken bones. A CT scan can detect blood clots, muscle damage, cancers. It reveals dysfunction or change of structure in bones, muscles, and organs. An MRI uses strong magnetic fields to take pictures of the inside of the body. It is more detailed than a CT scan, but will often not show brain damage unless the trauma is severe. A SPECT scan, which the Amen clinics use, show what areas of the brain are more active or less active to provide a very comprehensive overview of damage to the brain and what parts may have been damaged by the concussion. Medical support. If you have a serious concussion, you will need to consider the following. Everybody is different, but it is finding the key to your door. 1. Potentially medication to help with pain management, mood regulation, and brain function. 2. Manual therapy to help with pain management. And depending on where your pain level is, it's knowing that manual therapy can sometimes also trigger symptoms. Acupuncture and more gentle types of therapy can be better for you in the beginning. 3. Specialized neurooptometry to rebalance your brain. This is understanding that the eyes play a massive role in how your symptoms are manifesting. If you can get your eyes sorted, quite often a lot of the issues are helped. 4. Neurophysiotherapy. This helps the brain and the body to connect again to improve function. 5. Some sort of counselling to give you tools to work through the emotional upheaval that happens with brain injury. Occupational therapy, which can help you to learn how to plan and pace and get your life back in order again. But if you find that the medication or therapy is not helping you, then please let your specialist know. These things are designed to support you, and if they are not working for you, inform your medical team. They can't help you if they don't know that what you're doing isn't helping. Must-have accessories. As soon as you are diagnosed or currently still symptomatic, get the following items: a peaked hat and sunglasses for being outside. Some clients that I've worked with find it beneficial to have a hat with the flaps on the side. So especially when you're traveling in a car, the material actually stops the flickering in your peripheral. Or you could get sunglasses that have similar to horse blinkers, that you have a covering on the side so you actually don't get peripheral flickering happening for your eyes. Silicone earplugs for social situations and sleeping. So if you use the silicone safety earbuds that they sell in hardware stores, they don't necessarily, you still hear a little bit, right? So if you're in social situations, as long as people are close to you, you'll be able to hear them, but it blocks out the peripheral noise. And this is really what disturbs us when we go through brain injury, is too much input. So we want to find ways to minimize the input for now. Noise cancelling headphones for home life if you have others in the house. And during this time, you could even have on the noise cancelling headphones, if they are Bluetooth activated, you could play some binaural beats or a soothing sound to you that can actually stop the peripheral noise. An eye mask for sleep and periods of desensitization where you give yourself a brain bath. A weighted blanket, if you like the sensation, can really help to calm anxiety and help your body relax during sleep. Sticky notes for reminders, a journal to track your symptoms, and migraine glasses with a rose tinted lens may help. So thank you for listening to Chapter 3, Part 1, Tools. I hope this helps you and your family, and just know that each day is a new day. For your concussion, growth happens in the dirt, and keep going.